Thank you, John, for that very nice introduction. Before I get started, I need to note that my allergies are now in full bloom. So there'll be likely some speech disfluencies along the way. I'm going to start my talk with a discussion of prevalence of parental divorce in the United States. I'm then going to talk about the effects of parental divorce throughout the lifespan. After that, I'm going to talk a little bit about variability in children's response to parental divorce and talk about how harnessing or understanding this variability can help us develop effective interventions for these children. I'm then going to talk about the literature that's evaluated preventive interventions and treatments for children from divorced families, but I'm going to spend most of my time talking about 3 programs that have been rigorously evaluated. Then I'm going to tell you what I told you, or summarize. When we think about parental divorce, there are lots of ways that you can think about parental divorce. One is to think about the number of children who experience parental divorce each year. That's 1 million. Or you can think about, as John mentioned, the number of children who live with a divorced or separated parent. That's 10 million currently live with a divorced or separated parent. You can also think about the percentage of children in our country who will experience parental divorce before reaching the age of 16. That's 30 to 50%. Regardless of how you choose to think about parental divorce, it's very clear that a significant portion of children in our society experience this stressor. Before I talk about the effects of divorce in childhood and adolescence, it's important to note that although nearly all children experience distress after parental divorce, most do not experience clinical levels of mental health or behavioral problems. Most children rebound. Most children fare fine. However, 25 to 35% of children who experience this transition in family structure experience clinical levels of mental health or behavioral health problems. The risks that these children experience, or the elevation in risk that these children experience, are in multiple areas. And as you can see, some of these areas are life trajectory changers. Children whose parents divorce are more likely to use substances and abuse substances. They're more likely to engage in early and risky sexual activity. They're more likely to experience externalizing problems like aggression, internalizing problems like anxiety. They're also more likely to experience academic problems. Children who live with a divorced parent are 3 times more likely to drop out of school. They're also 3 times more likely to experience premarital pregnancy than are their counterparts in 2-parent homes. So lots of difficulties. The best way to think about the differences between children from 2-parent families and children from divorced family is provided by some meta-analyses. Brian talked earlier in his talk about the meta-analytic approaches. Amato and Keith did some work in the early 1990s where they summarized the findings of 91 studies on multiple outcomes in multiple domains. Children from divorced families fared worse. There are, however, a couple of things that are important to take away from this meta-analysis. First, the differences were similar for boys and girls. Both boys and girls were negatively affected by parental divorce in the same way, at the same magnitude. It's also important to note that on average, the differences were small. And the differences were smaller for better conducted studies versus more poorly conducted studies. In 2001, Amato did an update of the meta-analysis using 61 studies that had been published in the 1990s. Very similar results. For a significant portion of children and adolescents, the effects of parental divorce continue or persist into adulthood. And what do these effects look like? Here again, you see multiple areas of adjustment or functioning are affected. Substance use and abuse. Adults who have experienced parental divorce in childhood or adolescence are more likely to have a mental disorder. They have lower educational attainment, lower occupational attainment, lower income, lower life satisfaction, and more marital problems, higher rates of divorce, and more physical problems than their counterparts who grew up in two-parent families. They're also likely to live 4 years less than their counterparts in two-parent families. It's important to note that the effects extend beyond the next generation. There was a large nationally representative sample in which adults whose grandparents had divorced were compared to adults whose grandparents did not divorce. We see some important differences that have an impact on multiple aspects of functioning. They had lower education, more marital discord, and weaker ties with both their parents. From what I've said, you've probably concluded that there's a public health burden of parental divorce. We talked about how divorce is prevalent, about how it has broad and far-reaching effects. We talked about some outcomes that are associated with parental divorce, lots of outcomes that are associated with parental divorce. Many of these outcomes have high societal costs. I've selected one here, substance use problem. The societal cost of substance use problems is $600 billion a year. From my perspective, these costs, or this cost only even, highlights the importance of developing effective treatment and preventive programs for this group of at-risk children. I talked a little bit earlier about variability in response to divorce. The critical question is, what factors determine who sinks and who swims? Not everybody swims, not everybody sinks. How do we understand the differences between these two groups? Clearly, there are lots of factors. Some are modifiable, some are not. The ones that are modifiable are of most interest and importance to thinking about how to help these children. This slide shows Mavis Hetherington's large theory of children's adjustment after divorce. And as you can see, there are lots of factors that may play a role in determining how children adjust after parental divorce. There are parent characteristics, like personality and education. There are divorce-related stressors, like moving, like having less contact with both parents typically, having less contact with relatives, having fewer material resources. There is level of parent social support. There's family composition. Are new partners coming in and living with the family? Is remarriage occurring? Is another remarriage after the first remarriage occurring? Parental distress also affects how children respond after parental divorce, and family processes are a key player. By family processes, I mean things like quality of the parent-child relationship and also the level of discipline and monitoring that occurs in the household. And as you'll see, there's a big box of child characteristics: age, intelligence, problem-solving, control beliefs, all affect how children fare after parental divorce. I'm going to focus now on the empirically supported modifiable correlates. And again, I'm focusing on modifiable correlates because these are the variables that give us leverage in terms of affecting children's post-divorce adjustment. I'm going to start with family processes. Everybody in this room, I'm sure, knows that interparental conflict is the most damaging aspect of parental divorce. Some conflict is overt, yelling, pushing, shoving. Some conflict is covert. Things like, did he feed you hot dogs again this weekend? Or relatives thinking that they're helping by saying negative things about the ex. And in children's earshot. Relationships with mothers and fathers is another big family process variable in terms of showing very consistent relations with how children adjust after parental divorce. The two components that come up again and again and again in terms of consistent relations are warmth and effective discipline. There are also divorce-related stressors other than interparental conflict that affect children's post-divorce adjustment. There are multiple changes that happen in most families after divorce, and we know that the nature and number of these divorce stressors are related to how children do or fare after parental divorce. Here are some child characteristics that have been shown to consistently relate to how children fare after parental divorce: self-esteem, locus of control, active coping, coping efficacy, avoidant coping, and fear of abandonment. There's also a growing body of research that looks at the additive, interactive, and mediating effects of some of these variables that I've talked about and some of the variables in Hetherington's model. Again and again and again, we've shown as a field that quality of parenting by each parent makes an independent contribution to children's mental health after divorce. We've also shown that fear of abandonment partially mediates or explains the relation between divorce-related stressors and mental health problems after divorce. We also have strong data to show that high-quality parenting mitigates or interrupts the relation between divorce-related stressors and children's post-divorce outcomes. This is a graph of some of the work that we've done looking at maternal warmth as a buffer of divorce-related stressors. And as you can see, when there's low warmth in the mother-child relationship, there's a pretty steep association between divorce stressors and internalizing problems. When warmth is high, that relation is attenuated or mitigated. I mentioned earlier about how understanding variability in children's adjustment to divorce can help us with designing and refining preventive interventions or treatment programs. Theoretically, if we change the empirically supported correlates that I've talked about or are in Mavis Hetherington's model, we should see changes in mental health problems. Some program developers, I'm going to talk about a couple of them later, have articulated small theories of change using these modifiable correlates. They then test to see if their interventions affect these modifiable correlates. And I'm going to argue, many people in the field argue, that such analysis can be very, very important for program design and refinement. Okay, now I'm going to switch to providing a brief review of the empirically evaluated programs. I recently did a review of treatment and prevention programs with some of my students and colleagues. We included studies that either used an experimental or a quasi-experimental design. We found 17 programs. 8 were child-focused, 6 were parent-focused, and 3 included both parent components and child components. When we looked at these studies, there was marked variability. In terms of methodology, some used random assignments, some didn't. In terms of assessment methods, some used single reporters, others multiple. Some used single methods, some used multiple. And there was wide variability in terms of the quality of the measures or the psychometric property of the measures. There was also variability in assessment of whether or not the researchers looked at maintenance of effects and whether or not there was attention to how do we understand the changes that happened. I'm going to briefly review these programs by type of program. I'll talk about the content and format of the programs. I'll talk about what the effects were at post-test. I'll talk about do we know anything about maintenance, and talk about our understanding of how or these changes occurred. I'm coming back to Hetherington's large theory of adjustment, and here I've highlighted the boxes that are targeted by the programs that I'm going to be talking about. So you see there's lots of possible targets, modifiable correlates of children's post-divorce adjustment where we have leverage. We can change these variables, and they should, at a theoretical level, change or improve children's mental health outcomes after parental divorce. I'm going to start with the child-focused programs. The child-focused programs typically have 6 to 8 children per group, so they're small, and they're co-led typically. Sometimes they're led by a single leader. The length is variable, 6 to 12 sessions. All of them are school-based. And not surprisingly, there are didactic and experiential components to each of these programs. The targets of these programs are remarkably similar. Typically, the programs focus on emotional support, problem-solving, coping, education about divorce. Some of the programs focus on expression of feelings, as well as helping to teach children appropriate control beliefs. Most of the programs, 6 of the 8 programs, have been evaluated in only one trial. 6 of the 8 programs also assessed program effects immediately after the program. 5 of the 8 found significant effects on one or more of the outcomes of depression, anxiety, learning problems, competence, and visits to the school nurse. Do the program effects last? Well, only 2 of the 8 programs did any kind of follow-up. And the follow-ups that were done were relatively short, 1 to 2 year follow-ups. And both of these short-term follow-ups found positive effects. One found fewer cases of clinically significant problems. The other found fewer classroom adjustment problems, lower anxiety, and fewer visits to the school nurse. None of the researchers studying child-focused programs have asked the question, how do we understand what accounts for these changes in children's outcomes? Several plausible candidates. Some of the more likely candidates, from my perspective, are coping, support from leaders and other children, and changes in control beliefs. I think mediational analysis is really important, not only to understand why the program affects change the way it does, but also for program refinement. It's possible that some of the components in the program are inactive. If they're inactive, we could eliminate those, and there'd be important implications for cost effectiveness of the programs. Okay, I'm going to switch to talk about parent-focused programs. There have been 6 programs that have been evaluated, 4 for residential mothers, 1 for non-residential fathers, and 1 for couples. The programs for residential mothers and non-residential fathers are group-based, 6 to 16 parents per group. The couples program has some meetings that occur just for the couple and some where couples get together in a small group. As you can see here, the length is pretty variable, 4 to 14 sessions. Unlike in the child programs where the content was pretty uniform, the content of the parent programs vary widely. 4 of the 6 programs focus on quality of the parent-child relationship, effective discipline, and reducing children's exposure to conflict. 2 programs focus on conflict management. 2 focus on improving the parent's mental health and post-divorce adjustment. The program for non-residential fathers focused on, in addition to some of these other variables, commitment to parenting. The couples program included a segment on mediation-focused therapeutic resolution. 3 of the 6 programs examined effects immediately after the program. 3 of the programs, one mother program, 1 father program, and 1 couple program, found significant effects of post-test on internalizing, externalizing learning problems, or 2 or all 3 of these. And only 1 of the programs was evaluated in more than 1 trial. We like to see replication. We have more faith in the findings when they happen again and again. Follow-ups have been conducted for 2 programs. Both of these programs are mother programs. The length is very variable, 6 months to 15 years. I'm going to talk in detail about both of these programs, and I'll talk about the follow-ups. For now, just take a look at the range of the outcomes that were maintained. They involve competencies, and they involve behavior problems, some of which are very serious behavior problems like substance use and abuse. Unlike the child programs, we do have some understanding of what accounts for change in the parent programs, but really only the programs for mothers. And I'm going to be presenting these findings later. I'm going to switch now to talk about the Parent Plus Child programs. And the thinking underneath the Parent Plus Child programs is more is better. The thinking is that if we work on those variables that mothers can control in a program for mothers, and we work on those variables that children can control in a program for children, we should get more than if we work only with mothers or children. There have been 3 trials of mother plus child programs. The nature of the child programs is remarkably similar. Heavy focus on coping skills, heavy focus on emotional support. The nature of the parent programs, however, was very different. One focused on parents' divorce adjustment, thinking that there'd be a trickle-down effect. We make mothers feel better, we improve mothers' mental health, and it trickles down to children. Another one of the programs taught parents skills to support the skills that the children were learning in the child coping program. And another program focused on parenting, exposure to conflict, and contact with fathers. There were no significant additive effects on mental health outcome in any trial at post-test or follow-up. One of the studies on parent plus child programs was one that I completed with my colleagues. And at the post-test, we said, well, there are no additive effects. Well, maybe the skills need time to incubate. Maybe the children need to practice the skills, use the skills effectively before the skills translate into mental health outcomes. So at 6-month follow-up, we were eager. We thought, well, maybe we'll find additive effects now. No additive effects. At 6 years, we thought, well, if the additive effects are going to occur, they should occur by now. Again, no additive effects on mental health outcomes. 15 years out, again, no additive effects. The takeaway for us is more is not better here, and I'll talk about, well, why might that be the case. And the good news is we don't need a program with 2 components. We don't need a program that costs twice as much as just having a program for mothers. I want to point out that the results that we find here in terms of a lack of additive effects is not inconsistent with other assessments of additive effects with other problems. For instance, in depression and aggression, the researchers do not find additive effects of a parent plus child program. Well, why? We spent some time thinking about this. And here I'm going to talk to just the research that's looked at additive effects in programs for divorced children. The ones that were assessed were all separate programs, children and parents. And it's possible that maybe some conjoint activities would need to take place for the parents and the children to practice the skills they're learning together. It's also possible that the programs may not have targeted the most impactful correlates of mental health problems. I talked about one of the programs doing the trickle-down effect. Well, maybe there are more important or impactful correlates that if we were to change them would result in additive effects. There's also the possibility that there's redundancy in the effects of the components. Possibly child resources are affected by changing parents' behaviors. And in some of our work, we explored this issue of redundancy of effects. And here you can see that participation in the program for mothers increased relationship quality at post-test, and changes in relationship quality, improvements in relationship quality at post-test, increased active coping, and increased coping efficacy at the 6-year follow-up. So here is support for redundancy of effects. We improved the quality of the mother-child relationship, and those improvements lead to children changes in children's coping. Okay, I'm going to switch to an in-depth review of 3 programs. The 3 programs I'm going to focus on are Parenting Through Change, and this is a program developed by Marian Forgach and her colleagues at Oregon Social Learning Center. I'm going to focus on the New Beginnings program, a program I developed with my colleagues at Arizona State University. And I'm going to focus on a program developed by Joanne Pedro Carroll and her colleagues at University of Rochester called the Children of Divorce Intervention Program. I selected these for several reasons. One is all of them were strong methodologically. Random assignment was used, program to control. They also all used multiple reporters of children's adjustment problems. When we see convergence, we have more confidence in the findings. They were also the only 3 programs that had been evaluated using follow-ups of 2 or more years. Also, all the programs are manualized, a significant strength when we think about implementing these programs, and training is available for all 3 of these programs. Again, thinking ahead to use and dissemination. I'm going to talk first about the Parenting Through Change program. This program is based on coercion theory, and in this theory, divorce is viewed as increasing the risk for poor parenting, which leads to negative child outcomes. Marian Forgach and her colleagues targeted 2 aspects of parenting: coercive discipline and effective parenting practices. And here's the small theory. I talked early about some program developers have articulated small theories and tested the small theories. In this small theory, divorce is hypothesized to decrease appropriate discipline, decrease monitoring, decrease skill encouragement, decrease positive involvement, and decrease problem solving. The Parenting Through Change program teaches skills to increase appropriate discipline, increase monitoring, increase skill encouragement, increase positive involvement, and increase problem solving. Program-induced changes on these aspects of parenting are hypothesized to decrease internalizing and externalizing problems. The Parenting Through Change program has been evaluated in 1 trial. The mothers were assigned to either the parenting program or nothing. There were about 240 custodial mothers. All of them had boys who were in grades 1 through 3. In addition to the pre- and post-test assessments, you can see there are a number of short-term follow-ups, and there is 1 longer-term follow-up of 9 years. The program is a 14-session program. In addition to meeting weekly, there's a midweek phone contact that happens between the leader and the mothers to see how the program skills are going. The groups vary from 6 to 16. They're co-led by 2 leaders. And there's a focus, not surprisingly, on enhancement of parenting skills. And there's a didactic and a practice component in all of the sessions. It's a highly structured program. You're going to see how highly structured it is when we watch a short clip. In this clip, the leader's modeling for the parents how they should go about introducing an incentive chart to their child. The leader has just demonstrated a wrong way to do this, and we're picking up on the leader demonstrating a right way to do this.
Successful, okay? So Shannon, we're still parent to parent, right? What is a good time in your house? And we're thinking about one of your kids, maybe one of the younger ones. What's a good time that they're in a pretty good mood, and you're in a pretty good mood and a pretty good space?
I would say they're in a pretty good mood after they've gotten home and they've had a snack.
Okay.
done all our lovey-dovey stuff.
Okay, great. So are you at a table?
Yeah.
Okay, so we just snuggled and had some really good mama kid time, right? All right, so we're at the table still. Oh, okay, so I'm going back in. I'm the parent, you're the child. Let's back up a little bit. We're good, okay. So, Shannon, oh my gosh, I'm so excited. So I have a snack for you. So here's your snack. You're welcome, you're welcome. I just wanted to tell you that I have been so proud of how well you have been behaving in school. I haven't gotten one phone call from your school. Thank you so much. And you and your brother have been getting along really well, and I really appreciate that. So good work. We're gonna get some lovey-dovey, right? Okay, good job. So I am so excited to show you this because I think you might like it, and I made it like kind of fancy for you. So we are going to start doing a chart to help clean our room so that we know how it's done, okay? And if you can see, and the first step is getting up. No, this is our morning routine, right? So in the mornings, I know it gets really crazy, and I want to make sure that we set ourselves up to do good stuff in the morning, right? And you can leave to school happy and ready to go. So we're going to get up in the morning, and guess what happens if you get up? You get a point. Yay! And then you're going to eat breakfast and take your medicine. That's 2 more points. Do you remember what 2 plus 1 is? 3. Good job, good job. Then you're gonna brush your teeth, and that's another 2 points just for brushing your teeth. And you like to brush your teeth, so I think that'll be good. And then you're gonna get dressed and put your shoes on. That's 3 points. And then you're gonna get your hair done. So you're gonna come to me and I'll get your hair done. That's 2 more points. So you have an opportunity to get 10 points. And once you get 7, we are going to pick one of the incentives that I'm willing to give. So today we can do, and guess what? It's morning time. So we are going to go ahead and walk through this whole routine, and you're going to be able to have me walk you to school. Yay! So stand up, okay? You're up. Guess what you get? 1 point. Yay! Good job. All right. So now we're going to go eat breakfast, and here's your meds. Good job. So you get 2 more points. Now we're going to go to the bathroom and brush our teeth. 2 more points. Good work. Now you're going to get dressed. So here's your clothes. We set it out already, so you can get dressed. All right, and now you're going to get your hair done. So I'm doing your hair. Guess what? I'm walking you to school today. Yay! Great. So time out. Okay. So how then you can go back to your seat. Actually, thank you very much for helping me with that. I appreciate your help. Thank you. Okay, so what did and it might look different because we have different ages of kids. That was a younger kid, so I'm a little more animated, right? If you came to one of your teenagers, they may not think you're so cool, right? Which they probably don't anyway, but you know your kids best. So what's one thing that you noticed that I did to set my kid up for success?
You started with what she liked first.
Yes.
And what you've enjoyed seeing her do.
What do you think that did for the tone?
It got her in tune to where you were and listening to you.
Right. I kind of like set the tone for, okay, this is exciting. You're doing good. I noticed you're doing good. It kind of like, okay, yeah, I can listen to you if you're praising what I did. Lorna, did you have another thing you saw that I did with
As you saw in the component where the leader was demonstrating the skills to the group, was very, very systematic and step-by-step modeling. The leader also tailored the skills to the mother's child and modeled at many points how to reinforce the child for positive behavior. In the debriefing, you saw the leader have the parents identify the reasons for her behavioral choices. And you saw how reinforcing the leader was and how active and involved the moms were. In terms of post-test and short-term follow-up results, at post-test, there were no significant program effects on parenting or child behavior problems. At 6-month follow-up, there were significant effects on parenting, but no significant effects on child behavior problems. Here we have the results of the short-term follow-ups, and as you can see, there are still parenting effects, and at 2.5 and 2 and 3 year follow-ups, we see some changes, improvements in children's behavior problems, noncompliance, externalizing, internalizing, and at 3-year follow-up, delinquency. At 9-year follow-up, and this is when the boys were in 8th through 11th grade, there are program effects on 2 important indicators of adjustment: delinquency according to teachers and arrests according to police records. Marian Forgatch and her colleagues did address the question of how do we explain the effects that occurred. The effects on noncompliance at the 2.5-year follow-up were due to or accounted for by changes in coercive discipline and positive parenting. The effects on delinquency and arrests occurred because of changes in effective parenting and subsequent changes in delinquent peer associations that were related to changes in parenting. Okay, to summarize the Parenting Through Change program, there's been one trial that's been conducted with boys only, positive long-term and short-term effects on externalizing outcomes, and the improvements in externalizing outcomes are due to 2 aspects of parenting that were targeted in the small theory of change and targeted in the intervention, and changed as a result of the intervention. Okay, now I'm going to switch to talk about my program, the New Beginnings program. In designing the New Beginnings program, we borrowed from 2 theoretical models, the transactional model and the risk and protective factor model. The transactional model posits that aspects of the social environment lead to problems and competencies. Those problems and competencies lead to later social environments, which lead to later problems and competencies, so on and so forth. In the risk and protective factor model, the likelihood of mental health problems is viewed as due to exposure to risk factors and the availability of protective resources. This is the small theory that underlies the New Beginnings program. We hypothesize that divorce decreases mother-child relationship quality, decreases effective discipline, decreases opportunities for fathers and children to get together, and increases children's exposure to conflict. The New Beginnings teaches skills that address each of these family processes. The thinking is that program-induced changes in these variables will lead to less internalizing problems, less externalizing problems, and more competencies. We have done 2 trials of the New Beginnings program, the mother component of the New Beginnings program. The first one that we did was a small study, 70 primary residential mothers, kids ranged in age from 8 to 15. It was a waitlist controlled design, so we could only look at pre and post assessments. The program consists of 11 group sessions. There are 2 individual meetings that occur between the leader and the mom. The groups are small, 6 to 8 mothers. They're co-led by 2 leaders. And like Marian Forgatch's program, the focus of the program is enhancement of parenting skills. There's didactic and practice components, lots of role play and feedback on the skills, and review and troubleshooting of mothers' use of the skills with their children at home. We're going to watch a short clip, and here we're picking up on a review of home practice. This is right at the beginning of session 5. To give you some context, session 3 and 4 focused on good listening skills.
Wants to start. How about how many listening skills going?
Good, better.
Better?
Better.
Better how?
I'm just listening better.
Oh, you feel like you're listening more?
Yeah.
What specifically which pieces seem to be,
Using the big ears and stopping to listen to what I'm, like I said earlier, what I'm hearing, what I'm actually hearing versus what I think I'm hearing. Because of the emotion behind it.
yeah.
And it takes out when you pause, it takes out that emotional response. Yeah. And it shifts the interactions. So
It's so true. That's really great that you notice it too, because that makes it more powerful the next time. The big ears is important. I mean, we don't really talk a lot about it, but it's just the attitude of, okay, I'm here to listen to you. Being open. That's great. How about how have you noticed David? Is it David mostly that?
he's talking more.
Oh yeah.
And I think it's me giving him that space to do that. Instead of doing the quick fixes and the lecturing and the, he's more open and seems to be more relaxed.
Oh, that's good too. So not just talking a lot, but actually his feeling. You can feel that he's less tense.
Yes.
Which is great.
Yeah. So that's good.
Good for you. So how was your honeymoon? Having some?
Okay, and here you can see, like in the Parenting Through Change session, that the leader is very reinforcing. She also explicitly makes the connection between changes in mother's behavior and changes in the child's behavior. So you're listening different, and he's telling you more. And like in the Parenting Through Change program, you see how the mothers are very active and engaged in the program. In the first trial, we found program effects on decreases in total behavior problems, and we found change was greater for those who came in with highest levels of problems, and suggesting that those who are most in need benefit most. We conducted mediational analysis, and we found that improvements in children's behavior problems was accounted for by changes in quality of parenting, providing some support for that small theory underlying the program. The second trial was the trial where we looked at additive effects of the child coping program. So families were randomly assigned to the parent program, the Parent Plus Child program, or a literature control program. The sample was larger than in the first trial, 240 primary residential mothers with children aged 9 to 12. The age range was narrower because we had a child coping component and needed to have developmentally sensitive activities. We did, in addition to pre and post assessments, a 6-month follow-up and a 6-year follow-up, a 15-year follow-up. We just submitted a grant to do a 24-year follow-up. At that point, our kids will be between the ages of 32 and 35. And in addition to looking at our kids, we're looking at the relationship that our now adults have with their romantic partners and their children. And we're looking at whether or not there is essentially a trickle-down effect of the New Beginnings program on parenting, as well as perhaps reducing the likelihood of substance use in the grandchildren of the mothers who participated. We'll probably be doing other follow-ups. I'll be in the nursing home following this sample. Okay, what did we find? At post-test, we found effects on parenting. Mother-child relationship quality improved, effective discipline improved. We found significant effects on the 2 aspects of behavior problems that we measured, internalizing problems and externalizing problems. At 6-month follow-up, we had maintenance of effect on 1 aspect of parenting, mother-child relationship quality, and we had maintenance on 1 kind of child behavior problem, externalizing problems. Like in the first trial, we found that improvement was greater for those who came into the program with higher behavior problems. Again, the program benefits, from our perspective, those most in need. And here you can see the differential benefit. If you look at the the left side of the graph, there's no separation between the two groups when children have few externalizing problems. As you move up the continuum, more and more externalizing problems, you see the groups separate and significant differences occur between the two groups. About 60% of our sample benefited from the program on externalizing problems. We spent a lot of time thinking about what kind of effects we'd have at 6 years. We were delighted when we found the maintenance of effects at 6 months. Not all programs have maintenance of effects, but at 6 months we thought, boy, that's great. We expected it, but we were nevertheless happy to see it happen. We thought that the effects could be maintained over time. The moms knew the skills, they were using them. We also thought the effects could fade. The new skills could weaken, and other factors could influence development. This was a particular concern for us because of where our kids were developmentally. They were moving into adolescence. Some of them were moving into puberty and adolescence. We also thought, borrowing from the transactional model, that maybe the effects would increase and spread as a function of a positive cascade of effects. And we'll come back to this notion of a cascade of effects in a little bit. But you can see the thinking behind that third hypothesis with the graph at the bottom. Here are the 6-year follow-up results. As you can see, we have program effects on multiple aspects of behavior problems: alcohol, marijuana, other drug, polydrug use, number of sexual partners, diagnosis of mental disorder, internalizing problems, externalizing problems. We also have program effects on multiple aspects of competencies. Some include self-esteem, grade point average, active coping, and occupational aspirations. Many of the effects, again, echoing what we found earlier, were stronger for those who came into the program at higher risk. Here's a bar graph that shows the differences between the two groups on diagnosis of mental disorder. Here's a bar graph that shows the differences between the two groups on getting an A or B average. I mentioned earlier maybe the effects would grow over time because our thinking is because of that positive cascade of effects. And we did find support for the effects on internalizing and externalizing problems growing, increasing over time, as well as for coping and self-esteem. Here are the 15-year results. Our kids were emerging adults or between the ages of 24 and 27. Again, effects on multiple aspects of behavior problem, some substance use disorders, polydrug use, cigarettes, number of sexual partners, incidence of mental disorders, time in jail during the last year. We also had effects on competencies, self-esteem, self-regulation, work competence. The one that I'm most excited about in terms of the broad reach of this program is we affected attitudes towards parenting of our emerging adults, which makes me think that maybe we will have an effect on the grandchildren of the mothers who participated in the 24-year follow-up. It was also the case that for those who had children, we had an effect on positive and responsive parenting for males only. As you'll see, some of these effects are specific to males, but most of them occur for males and females. Here's a bar chart describing the difference between onset of internalizing diagnosis from adolescence to emerging adulthood. Big difference across the two groups. We have looked at the question, how do we explain these effects? These effects are pretty remarkable, but we want to understand them. Why is it that these effects occur? And as you can see from what's on the slide, the changes that occur are due to changes in mother-child relationship quality, effective discipline, and parental monitoring. Aspects of parenting. We've done some cascade effects modeling of behavior problems, and I'm going to point out only a couple things from this figure. One is you see continuity within domain. Internalizing problems, externalizing problems, alcohol and marijuana use at 6 years predict those same behaviors at 15-year follow-up. You also see some cross-domain relations. Internalizing symptoms are predicting polydrug use. Externalizing symptoms are predicting internalizing diagnosis and several aspects of substance use problems. We've done some cascading effects models of competence, and just to note, there are many fewer significant paths, and they're specific, unlike with the behavior problem model that we just looked at. We recently did a cost-benefit analysis, and here we were interested in looking at what are the costs of implementing the program relative to the monetary benefits of participation. We looked at 3 indicators of benefits, monetary benefits. We looked at mental health service use, the mothers and the young adults. We looked at medication for psychological problems, the mothers and the young adults. And we looked at criminal justice system costs for the young adults. And we looked at expenditures in a relatively conservative way, looking at only the 1-year period right before the 15-year assessment. The program more than paid for itself. In fact, there was a 1-year cost savings of about $1,500 per family. We were clearly very excited about these findings and did a lot of work in the program. And for those of you who will be at my workshop later, I'll talk more about this. A lot of work on the program, making it ready for the population of divorcing families and making it viable to be used in community settings. And we're testing the program in an effectiveness trial now. It's an effectiveness trial that is supported by NIDA. In addition to asking the main effects question of what is the effect of the New Beginnings when it's delivered in community settings, we're asking the question of, are the program effects moderated by variables like SES, gender of parent, and child age? One of the things that I'm particularly excited by in this trial is we have a large number of fathers who are participating in the program, about 400 fathers. And a critical question for us to address is, what is the level of contact between the father and the child that's needed for the program to be effective? Okay, to summarize the New Beginnings program, we've done 2 trials, both found positive short-term effects. The trial that included follow-ups found positive effects on multiple behavior problems, multiple competencies, up to 15 years after the program. And the mediational analysis showed that by changing parenting, we change children's behavior problems. In some sense, not a surprise, right? But important to demonstrate what the active components of the program are. I'm going to switch now to talk about Joanne Pedro Carroll's program. Joanne and her colleague have done 6 studies. Some of these studies used random assignment. 2 studies included short-term follow-ups. Her program is a 12-session program, small group, 8 to 9 children, and it's co-led by 2 leaders. She has developed versions for 4 different age groups. The skills taught are the same, but the specific activities vary so that they can be developmentally sensitive. The targets in her program are sharing feelings about divorce, clarifying common misconceptions about divorce, adaptive coping skills, and providing support from the leaders and recruiting support from the other group members. This slide shows that, and it's summarizing across 6 studies, that nearly all the children benefit markedly across multiple aspects of functioning from participating in this program. There has been an independent replication. The program has been evaluated in 10 sites in Holland, and there are improvement on multiple measures of children's outcomes. Important work. Do the effects last? Joanne has done 2 short-term follow-ups, a 1 and a 2-year, and here are the outcomes on which lasting effects occurred. Important indicators of adjustment. What accounts for program effects? No mediational analysis have been conducted. These changes occur, they're very positive changes, they last 1 to 2 years after the program, but we don't have an understanding of why the changes occur. Possible candidates, the most likely ones from my perspective, are coping, social support, and effective emotional awareness and expression. To summarize this particular program, there have been 7 trials that have been conducted. All have found positive effects on behavior problems, and there's been a replication by a research group that's not associated with the program developer. This is a significant strength of this program. However, no mediational analyses have been conducted, nor has maintenance into the next developmental level been examined. Okay, to conclude, well, there's bad news, there's good news, and there's even better news. The bad news is parental divorce is a very prevalent stressor, and lots of the kids don't swim. They struggle. 25 to 35% of youth whose parents go through parental divorce have significant mental health problems, and for a not insignificant number, these effects last into adulthood. The good news is there have been 17 programs that have been experimentally evaluated. Of these, 3 were rigorously evaluated and found to have positive short-term effects on important outcomes. 2 have been shown to have positive long-term effects. I'm going to end with what I consider the even better news, and that is if we're able to implement these programs at a large scale, on a large scale basis, the public health burden of parental divorce can be substantially reduced. Thank you.